Hello everyone, let's try to solve this question together. So here we have an X-ray which is obtained from a newborn infant. Based on the findings, the true statement is, so the statement could be right, but which is the best statement you guys think? So what do you guys think is the correct answer here? Pause the slide, zoom the picture. Okay, the correct response here is surfactant might help. Although the gestational age is not given, but you see the lung on both sides, right and left, look like a ground glass appearance, and you see this is the heart silhouette, and you can see that you barely see the aeration of the lungs. So surfactant would be of help here. Now what about eliminating the others? So ET tube, which is the endotracheal tube, is in the esophagus. Although this looks like that this is rotated, the film is a little rotated, but again it's very difficult to comment that this is in esophagus unless you do the auscultation examination on the stomach here and look at for bilateral sounds and look at the patient's heart rate change. So ET tube position in the esophagus is basically a clinical determinant unless you have a video laryngoscope where you can directly visualize where the tube is. So again, because we cannot comment on X-ray, so this is not the right choice. Ascites could be considered. We have all learned during our training that when you have this center, like when the gut is put into center and you see opaque the paracolic gutter, you can consider ascites. But again, like I said, if you're not definitely sure on X-ray, you cannot commit this answer. Now with the point of care ultrasound, it's really easy to just put the probe on both sides of the abdomen and know if there is fluid or not. So that should be done. What about lung hypoplasia? Like I said, the aeration is not great, and you can see the lung is expanded barely, like a 6+ ribs. So probably it's a surfactant deficient lung rather than the lung hypoplasia. So once the surfactant is given and the lung inflated, then you can rule out in the lung hypoplasia. So the point which I want to make, that for a question or in clinical scenario, only one answer is not the right answer. There could be multiple things we can do together. Like in this case, we can check the ETT position, like I mentioned, through the examination, through where the SATs are, what is the baby's clinical scenario. About ascites, you can just quickly do the point of care, and about lung hypoplasia, we can do surfactant and then follow at the expansion of the lung and see. So I hope this is a stimulating case and you guys have learned something together today. Please do like and subscribe to our channel, and you guys have a wonderful day. Bye.